A cancer journey is one that no one should walk alone. In February of 2006, I was diagnosed with ovarian cancer. I remember I had just gotten back on campus from my lunch break, and I remember feeling a pain in my abdomen. At first, it felt like gas, but it got to a point where it was so bad I could not walk. And with that level of pain, I knew it wasn't gas. I was able to make it to my classroom when my friends came to assist me. And at the time, they gave me a cup of water and a mint because, of course, we were thinking it's gas, and that didn't work. The school nurse was called, and she took out a cotton ball and a bottle of shilling oil. She put it to my nose. And when she did that, a whole lot of other things started transpiring. The scent from the shilling oil went down and grabbed a hold of the mass, and it started torsing. And at that time, I started passing out. And I was passing out and coming back, passing out and coming back because the pain was so bad. I ended up in the hospital a few days, and my gynecologist said to me, Donna, you're going to need to go off island because with what you're dealing with, we don't have any doctors here that specializes in that. You see, before that, I was experiencing bloating, abdominal pain, trouble eating, feeling full quickly. I was urinating a lot, and my bowel movement had changed. I had lower back pain. I was tired a lot. And then there was unexplained weight gain and weight loss. I had gone to so many different doctors on island, but no one knew what it was. After I was in the hospital, I came out, I jumped on the internet, did some research, and found me an awesome gynecological oncologist by the name of Dr. Lambrou. He was just awesome. He took the time to get to know me. And Dr. Lambrou, Patty, and I, we worked together as a great team. And I said to him, I want to go back home and educate others. Because when I was in the emergency room and I kept asking the doctor every time I come to, what's wrong with me? What's wrong with me? They wouldn't tell me what it was, which I found strange. And when morning came around, I said, okay, I know I can do. And I just prayed and I asked God to let me know what it is. I got my answer. And when the nurse came back in the next time, I said, I don't know why, but you all are not telling me what it is. But I know what it is now. And I told her what it is. She went out and she mentioned it to the doctor, and they swear she was the one who told me. So the doctor came in. I said, no, she didn't tell me anything. You all wouldn't tell me. So I prayed and I got my answer. I said, but it's okay. You know why? Because I already beat this. I just got to go through this so I can get on the other side and I will be able to educate others. Because within my praying, I also asked God, why did you choose me? And he said, because I want you to educate others. So my goal was beat this thing and come back home and educate others. And I did just that. And I kept telling Dr. Lambrou that. And for my first presentation, we put something together. He worked with me. I presented and everything. And he was just there smiling from ear to ear. I'm like, why are you smiling so big? He said, you ready? I'm like, okay. And then my second presentation, I reach out again. He said, Donna, you no longer need me. You don't need me. You got this. So I came back home, went into working with the American Cancer Society, and I put a group of survivors together. And it was important to me that when I go out and speak, we're not just educating the public about ovarian cancer, but a whole lot of different cancers. It was like 10 of us, and each of us spoke on a different type of cancer. The community was hungry for the information. We got so much invitations. We were in churches, we were in communities, we were at the amphitheater in Sunny Isles. We did presentations every February at the agricultural fruit fair. It became so many. People were calling from St. Thomas, from St. John. Education is something that is really needed in our community, and people appreciate it. So I say to you, educate the public. It got to a point where we got so many invitations. We were spread thin. We had to start cutting down. And right now, we're not doing that right now. So it would be awesome for this group to put together a group of survivors to go out and educate the public. The public needs and wants the information. And then I became a survivor in 2006. Then in 2023, here comes breast cancer knocking on my door. I went back. I did my self breast exam and I found a lump in my left breast. And one of the things ACS did when we went out in the community, we had a doll that we took with us. And in one of the breasts, it was a regular lump. So people would know how a regular lump feels. And in the other breast was a cancerous lump. So if people felt that, you would know this is what it is. And strangely enough, when I felt that, I remembered the feeling of that. So I already knew I had breast cancer. I got on a plane again and went to the States and started my treatment. This one was extremely brutal. It was rough because my cancer has metastasized and it was moving really fast. It was really aggressive. But at no time did I ever think I ain't gonna beat this. Not me, because I know that the number one thing and the important thing is your mindset. And I know if God bring me to something, he gonna see me through it. So I know I was going to come out a survivor. So I hung in there, and this time I didn't have surgery first. I had endless chemo. Ooh, it was bad. I had so much chemo. And then after my chemo, I had surgery. And I told them I wanted a double mastectomy. But my doctor, I went back to Miami, the same place I was before. But my doctor I had before, he couldn't handle the breast cancer. He handled gynecological cancer. So I got a new doctor, and she wasn't good. And I know that because after being with ACS for so many years, I had learned some stuff. So I was asking questions. She didn't like when I asked questions. It's like I wasn't supposed to have a say in my cancer care. And I had a problem with that because that wasn't going to work with me. So I remember having a conversation with Denise, and Dennis is like, Donna, maybe I need to make a call. And I'm like, no, that's okay. I got it. I don't really want you all to be involved in it. She said, but you don't understand. You're there. So we're already involved. Denise, I gave her the information and Denise made a call. And then when I went to my next appointment, the doctor said, oh, how are you affiliated with the American Cancer Society? I'm like, "Ah, don't worry about that. That's not important. But she was like, hmm. But the long and short of it is, I knew I had to get out of there, but I didn't just want to just jump and do it on my own. So, as usual, I prayed about it and I asked God to let me know when he wanted me to move. And when he told me when to move, I moved. And I got out of there. I went to City of Hope. And that was the best decision I could have ever made. The nurse said to me, "It's going to take a while because we have to get your records and everything. And that takes time." I said, "I already got my records. I have my records on my phone. And I have a hard copy of my records too." She said, "But the insurance have to approve it and everything." I say, "Ain't gonna be no problem for it to be approved." She's like, "Oh, but this takes a while." I say, "I'm good." Cigna was just so awesome. They knew what I was going through and they assigned a doctor to me. I had a doctor and a nurse assigned to me, and I could call 24 hours and they had me. So when I call and I said to them, "I'm ready to make my move. I'm going to City of Hope and they're going to be calling." He said, "Okay, do you know what number they're going to call from?" I said, "No, but this is the number I called them at." Cigna didn't wait for them to call. They called. And within a nanosecond, City of Hope called me back and it's like, "You're clear. Okay, you can come and see." This don't normally happen this fast. I say, "I told you it wasn't going to take long with me. I know I'm going to listen and do what God tells me to do, and I'm going to move in His time." And as a result, the road was paved. So I went to City of Hope. This did what I needed to do. And they were looking at my records and asking me certain questions. I said, "No, that's not right. This is what transpired." And they're like, "How come your records is saying one thing?" And I gave them my phone so that they could read my notes because I always took notes when I went to the doctor. I listened to what the doctor had to say and I say, "Okay, she's stating da 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 da, but I actually know that it's da 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 da." And in speaking with Cigna, they guided me and they told me, and they're like, "We are so glad that you are here." I said, "And so am I, because if I wasn't, I know I would have no longer been here." So, this is what I want to say today. Go out and educate the community. It is so needed and it is so wanted. And from a survivor's perspective, one of the things that's really important is having a support group that you can go to and you can talk with. This is another thing that ACS did. We met monthly. It was survivors and family members and other people from the community. And we invited guest speakers. We went out on field trips. We ate together. We had fun together. We did so many things together. This is something that is very needed and very much appreciated by survivors. So if a support group can be started or something can be done, please do it because that's one of the things that's important to us. And from a community member's perspective, I would like to see more community outreach presentations. Like I said, it's needed and wanted. From a patient's perspective, it would be nice if here in the USVI, we could have specialty areas covered. We need more oncologists. We need more access to health care. More people may stay at home if they had the opportunity to. And on top of that, not everyone can afford to go off island for treatments. So we really need to be here at home so we could have that immediate support. I'm thankful for my family and friends. I'm thankful for the American Cancer Society and how they wrap their love around me. I am very thankful for that. Um, the American Cancer Society has done a lot and continues to do a lot in our community. We give grants to individuals that are battling, that's financial assistance. Patients and family members are allowed to stay at the Hope Lodge, both in Puerto Rico and on the mainland. And on the mainland, we have access to and from treatment if you're able to get connected with one of our drivers. That's our Road to Recovery program. We pay for cancer related medication, we pay for durable medical equipment. We do a lot. And then there's the Hotel Partners program. Patients are allowed to stay a certain amount of nights for free, depending on your treatment needs. When I travel, a lot of the times I stay at Extended Stay America. I do this as my way of giving back to them because they give to us and they gave to me in my time of need. So I make sure that I stay at Extended Stay America. And of course, there are times when I want to splurge and I go to another hotel. But most of the time, I stay at Extended Stay America so I can give back. And as for programs, there are a number of them up here. We do a lot, like I said, in this community, and I am so proud of what we do because we reach a lot of people, we touch a lot of people, and we love helping others. So, once again, thank you for having me. I am Dona Browne Jones, and I am a two-time cancer survivor.